Hello, Dr. Ameen. How are you doing today?
Hi, how are you, Shimili? I'm great, thank you so much.
I'm good. Perfect. So let's get right into it.
Yeah.
First of all, what do you think sets your teaching methods apart when it comes to implantology training?
Well, what we believe in implantology, we start basically, especially in that course, with the lectures, first day, full of lectures, videos, and hands-on trainings on typodonts. I've been personally through these overseas training courses, and what misses usually these courses, I think, is the lecturing and basically going in details about the procedure, not just like guiding information. I think what is missing lectures, and we are fully prepared to provide those attendees with lectures, detailed lectures about different level of implant surgical procedures, ranging from simple implant placement, flap designs, complications, anatomy, to difficult situations where we have to do sinus lifting or ridge augmentation or ridge splitting. Those attendees, full day before they jump into their surgeries, we prepare them mentally and, of course, knowledge-wise to go and practice and do the surgeries for 5 days. So in total, the course is 6 days, and the number and the different complexities of procedures that they really see every day is really amazing. We, like, for those who never placed implants or who already placed implant, but they don't still feel the confidence to place implants, we give them almost 30 cases of implant placement where they place the implants in the anterior area, posterior area, upper, lower, so different places, different complexities, aesthetic zones with multiple procedure like immediate implant placement, extractions and immediate implant placements, some bone grafting procedures with that. So after they do like almost 30 cases, they will feel very confident in, to go back to their offices and clinics and start practicing surgeries. For the second level, which is the more advanced level where they do like complex procedures like direct sinus lift, or ridge splitting technique, or full arch implant placements, or bone block augmentations. These procedures require people or dentists who already have placed implant in their clinic and they want to expand their knowledge and their capacity to treat different types of cases in their clinics. And that's what set us apart from other courses. I believe the clinical varieties of procedures that we give our attendees, and as well as the number of these procedures, and also I think the knowledge part, the lectures on the didactic preparation or lectures that presented the first day, we found it like very helpful to most of the dentists.
Perfect. In terms of the course, what are the most common breakthroughs or moments of growth you've observed in the past participants of this type of intensive program?
Well, they all come from different countries, and the first day is basically when they meet for the first time, they present themselves. We kind of like understand more about the level of their skills. And by the end of the course, after seeing those different types of surgeries and procedures, you can see the confidence and the happiness and the satisfactions of those dentists who already, attended the course. So one of the most important thing is actually finding surgeries, or whether they are doing the surgeries or assisting in these surgeries, they really face different type of complexities of procedures where they've never been, doing before. And this will, help them to go to their offices and start. And the more you practice, the more you can treat different cases in your office. And of course, this is a very good help for any dentist, whether associate dentist or an owner, to increase their knowledge first and their income second. Of course, we all feel and know very well that any return of investment out of this dramatically improving their I would say their income, their knowledge.
Sure. Okay. So, in terms of the Toronto residency, how do you plan to elevate the Toronto residency beyond just the technical skills?
So we've been doing this course for many years now. The implant residency in Toronto is really made and planned very carefully after studying all the courses in Canada. And we have found we were the only and the first people in Canada who implemented the the patient side of the surgical course and the prosthetic part as well is very important. So we decided that it is very hard for dentists to find cases in the beginning, and that's what most of the courses here now they ask the attendees to bring their own cases. So we decided that we need to provide the patients to our attendees, and we found number like 3 cases per participant, and they assist in 3 cases, but they can also bring their own cases, bringing like each participant can bring 1 or 2 cases as well, and this will elevate their surgical skills definitely. That's one part of the course that was really from other courses. The other part, we found that the prosthetic part was is covered in our course in very detailed lectures, hands-on, and then the course was structured so that we can time 3 months and a half, and then we go back to the residency module 5, where we present our lectures to the attendees, explaining in details and going in details on the prosthetic part, occlusion, and cover all these topics that really help the dentist to get the knowledge. And then after that, they go and they practice that on their patient. They expose their implants. They practice different types of procedures, whether it's digital impression or conventional impression. And then after that, they deliver the prosthesis, and it's all on our mentorship. We don't ask the dentist to go and deliver their restorations in their offices. We don't just stop at the surgical modules where they stop, like they place their implants. We really covered all these parts from A to Z in terms of lectures, in terms of the labs and hands-on practicing, and in terms of patients. They start with these patients from clinical exams, from the medical history, from the CBCT. We teach them how to interpret the information and take it out of the CT scan and go and plan their treatment. And not only that, we teach them 2 ways of doing or placing these implants. We teach them the digital workflow with surgical guide, and also we teach them the conventional way where they enhance their surgical skills by opening a flap and practicing different types of bone grafting, socket preservation, implant placement. So it is very comprehensive course. I think most dentists enjoy the surgical part, and they feel the satisfaction after they place also their first few couple implants. Most of them have placed 7, 9 implants in each time since we started years ago, and then we said we couldn't. So we promised 3 cases, but definitely they are practicing more. In every single course, that's the most important part. We have different types and levels of complexities. Every single course, there is full arch placement, there is single implant placement, there is multiple implant placement, and there is different types of bone grafting, socket preservation, and immediate extraction and implant placements. We do also, which I believe implant is a teamwork. It's not just like the dental surgeon goes to place the implant. If you don't have like a supportive team and the support from a well-trained team, the end result will not be ideal always, because where those patients are coming from. You should have a good reception, you should have a great treatment coordinator, and you should have well-trained dental assistants sitting beside you to perform the procedure and taking care of all these drills where because you're not going to go as a dentist to sterilize your instrument. Your team is doing that. And without understanding those drills and all the instruments that you're using, unfortunately, it's going to be very hard for the dentist. And that is why we decided to give full day of training in module 5. We give them full training days with our staff. Our manager, Nicole, she will teach the surgical and the details regarding the preparation and the surgical procedure. Well, I've been placing implant now for almost over 18 years, and I've been to many courses actually, where you'll be on the table, you place your implant on a peg or mouth or like a model, plastic models. I'm not saying they are not important, but really they are, if you compare them with the real experience in the patient's mouth, like you can't compare it. Um, the reason why I'm talking about the real patients, because real patients means that you're dealing with, number one, emotions from the patients. Number two, like you're dealing with the cheek, with the tongue, your sitting position, where are you going to sit? Like if you are placing implant on quad 3 or quad 1, what is the best way to look at the implant? Which angle? Where do you position yourself? Where your assistant is positioned? And of course, like the communication between you and the team and the communication between you and the patient. This is really, you can't teach them on models. You can't teach them on mannequins or pegs, because basically it is really, you can't really there's no emotions part in there. There's no stress. There's no obstacles like the cheek, the tongue, the bleeding, like it's completely different experience. And that's why when I, like personally, when I decided to get my training on implant, I spent almost 40, before I placed my first implant, 40 days. I went to India. I practiced with one of the most successful and well-known surgeon and author, Dr. Ajay Singh, in Agra. And we did, like, I would say minimum 80 to 100 surgeries in these 40 days. And I felt really confident before I came back and placed my first couple implants in my office. But let me tell you something, implant is, or implant dentistry is like the training is like a curve. And you really need to go slowly and increase your knowledge with time, because it's not enough to get to take the course and you stop. In my 18 years of implant placement, I have done over thousands of CE points, whether it is on a chair or table where you practice some procedures on pegs, or whether it's on where you really have the real experience of implant dentistry. Remember one thing, we in the dental schools, the amount of knowledge and training in implant dentistry is almost nothing, I would say. If there's anything, we get the theory, but there is no implant training. So that is why our residency program or our courses in Cuba, we prepare patients, because we believe that treating patients is completely different than just preparing yourself on the mannequin. We do both. We do the hands-on on mannequins, but at the same time, it is never enough to go to your office and feel the stress from minute number one. You have the patients, and the stress time is starting. What do I do now? How do I, like, versus you are in a course in that residency program where you've been exposed to many, I would say many, over 10 or 20 surgeries. And that day you can be exposed to other surgeries from your colleagues as well. And with this experience, when you go back to your clinic, you are very ready to see. And I have my residents, this is my case. Look, Dr. Ameen, I place these implants, and we support them even after the course. But what satisfies me really is to see them growing after the course and placing these implants on their patient's mouth.
Perfect. So with all that being said, I'd like to thank you for taking some time today to talk to us.
Thank you so much.
You have a lovely rest of your day.
Thank you so much. Thank you.